Well, the long-awaited redevelopment of University Hospital in Newark is finally underway. State and local officials, including Governor Murphy, were on site today for the groundbreaking of the project that'll invest nearly $2 billion into the hospital. University Hospital was built 45 years ago and has more than doubled the number of patients it serves since then, but its infrastructure hasn't kept pace with demand. It's worth noting that it's the only state-run hospital in New Jersey and the only level 1 trauma center in northern New Jersey. Raven Santana was at the groundbreaking to hear how the renovations will improve health care for residents in and around New Jersey's largest city.
For nearly 50 years, University Hospital has been a lifeline for Newark, a place where trauma victims, mothers, and families in crisis find care. But the public hospital's aging infrastructure has long struggled to meet the city's growing needs.
People talked about the promises that have been made to the city of Newark, and those promises finally being kept. We are investing in healthcare like we've never seen before in the city, and I can't wait to see that future.
Caitlin Baston, the hospital's interim president and CEO, joins Governor Phil Murphy, Newark Mayor Ros Baraka, and Rutgers leadership to mark what they call a once-in-a-generation investment, rebuilding the 45-year-old campus from the ground up in partnership with Rutgers. The hospital serves as the hub for Rutgers University's healthcare programs. The $1.8 billion modernization plan will replace outdated buildings with new administrative and clinical facilities, an expanded trauma and surgical wing, and state-of-the-art classrooms for Rutgers Health students.
Phase 1 is actually both of those buildings, but the first building going up is that administrative building, and that administrative building has a small amount of clinical space and is shared with Rutgers and University Hospital. It is what's replacing those temporary buildings that came down. And then right after that, the medical office building goes up. And so that is a big replacement medical office building that really will highlight the future of healthcare.
It's the latest in a series of upgrades. Just last month, the hospital unveiled a $20 million emergency department designed to handle more than double its original capacity. Built in the 1970s for 50,000 patients a year, now serving over 100,000.
Bracing for flooding in the hallways with a rubberized system into a garbage can because it is crippling on itself.
But not everyone is celebrating. Some Rutgers faculty say the investment is long overdue and must go further.
The University Hospital itself has had, I believe it's, 5 CEOs over the last 8 years. How are you going to have a vision if you're changing, the captain of the ship every year or two?
Diomedes Sitoris is executive director of the Rutgers union that represents medical and other clinical faculty. He says Rutgers' partnership with the Robert Wood Johnson Barnabas Health System, an underwriter of NJ Spotlight News, has strengthened healthcare statewide, but also deepened disparities.
Rutgers has a major relationship with the Robert Wood Johnson Barnabas. However, sort of one of the drawbacks of that, major relationship is that the focus is on your big 14 hospital partner. It's not as much on University Hospital or kind of, smaller projects that might be very important to the community.
Outside the event, a small group of protesters voiced frustration, arguing that the first structure being built benefits Rutgers more than the hospital itself.
They told the community after they transferred the money for the construction of the new hospital, we now find that they're building an administrative complex for Rutgers. Make it make sense. They're co-opting everything that university has, the resources, they're being stripped away and they're being diverted to other places, creating a position, putting it in a financially vulnerable position in terms of continuing operation.
In response to the criticism, city and state leaders say the redevelopment, unfolding in phases over several years, will transform the campus into a modern medical hub that will benefit the community and secure the hospital's mission for generations to come. For NJ Spotlight News, I'm Raven Santana.